Everyone, welcome. This is our Finding and Using High Quality Law and Policy Data webinar. It's part of Love Data Week 2026. We have a guide I'll put in the chat. You can check out the other events that have already happened. We'll be posting recordings there at that page, as well as there's one more workshop tomorrow at noon on statistical analysis. But today we are very happy to welcome some experts from the Center for Public Health Law Research at Temple University Beasley School of Law. And I'm happy to welcome Katie Morin McCabe, the lead law and policy analyst, and Lauren M. Langen, legal program manager, who are going to be leading this webinar. If you have any questions, feel free to put them into the Q&A feature. We'll have time to answer them all at the end. If you have any technical issues, please put that in the chat and we will try to address them. But welcome, and I'll pass it along to our expert panelists.
Thanks so much, Will. Hi, everyone. Thank you for joining the webinar today. Lauren and I are really happy to be here to talk with you all about the importance of high-quality legal data. Next slide. So just wanted to go over a quick agenda of what we plan on covering today, and we will make sure to leave some time at the end for to answer any questions. So we'll start by talking about what legal data are and why they're important. We'll then talk a bit about how to create legal data and where to find quality legal data. And then we'll go over how you know if legal data is high quality data. Okay, so diving right in, legal data. What are we talking about when we talk about legal data? So the legal data is the text of laws that's been converted into quantitative data. So the ones and the zeros that you see here on the Excel sheet. And we'll talk a bit about how this is done and why it's important to make sure that any legal data you're using is of high quality. But first, let's just talk a little bit about why having legal data at all is important. So we create legal data from the text of laws to make it easier to align with outcome data to evaluate the impacts of laws. So here on the screen, you can see a variety of studies analyzing the effects of different types of laws on various health outcomes. So this is just a sample of papers on a variety of public health topics. So from looking at the impact of cyberbullying laws to the effects of cigarette taxes and lung cancer incidents, to the impact of earned sick leave policy on the well-being of workers. And although these are all on different substantive topics, the one thing they all have in common is that they all use legal data in their analysis. These are all what we call legal epidemiology studies. So next slide, please. What is legal epidemiology? If you're not familiar, this is the scientific study of law as a factor in the cause, distribution, and prevention of disease and injury in a population. So this is a scientific approach to understanding how law influences population health, and it's crucial to assessing whether and how it does so. And it can also help us determine which laws are most effective. But if you want to evaluate the impact that laws have, you first need to know what the law says, which is data are needed. Next slide, please. So this is just one example using legal data on state-earned income tax credits to analyze the impact of those policies on food security. So Lauren will dive into this a little bit deeper shortly, but I just wanted to show you this to highlight why legal data may be important for your work. So this is a table from a paper discussing state-earned income tax credit policies over 40 years. And this is the legal data used in the paper from the previous slide that analyzes the effects of these policies on food security. So if you're doing a study on the effects of law, it's essential that you have reliable legal data to analyze. And that's why having high quality legal data is so important. So I just want to talk very briefly about how to create legal data, just to give you a quick overview. So at the Center for Public Health Law Research, we create a lot of legal data. We also develop and teach methods for creating legal data. And we generally use a type of scientific legal mapping called policy surveillance, which is the systematic collection and analysis of laws and policies across jurisdictions and over time. So the wheel on the right shows the overall policy surveillance process. We don't have time to go over that in depth, but happy to talk more about that later. We also have some great resources on our website that go through the entire process in detail if this is something you're interested in learning more about. But through policy surveillance, we don't just look at whether or not a law exists in a particular place at a particular time, but we also capture key features of the law. And also wanted to point out that you'll see quality control is in the center of this wheel. Quality control is a key part of the process to make the data reliable so that they can be used for rigorous evaluation. We also publish a research protocol for each data set that we create that includes details on the scope, the research and coding methodology, and that's to make sure that the process is transparent and replicable. This is a snapshot of the software that we use at the center to create legal data. So I mentioned a minute ago that with policy surveillance, we capture key elements of the law. And we do that by developing coding questions, which are just questions that we want to ask about the law, important things we want to know about the law. And we then use the text of the law to answer those questions. So Monocle allows us to do all of that in a very organized way. So on the screen here, you can see a coding record for Colorado. On the left are the coding questions that were developed. So the first one is, does state law allow for the operation of syringe services programs? On the right is the text of relevant laws that we collected for this topic for Colorado. So you can see here that the coding questions on the left have been answered based on the text of the law that was collected. And for each answer, the specific text of the law is tagged to demonstrate the specific text on which the answer is based. Monocle also converts the answers to these coding questions into quantitative legal data. So next, yeah, thanks. So the Excel sheet here is an example of the legal data page that's created once we've answered all of the coding questions. You can see here there are several records for each state. That's because we're capturing changes in the law throughout time. So each record, each row in the spreadsheet represents a unique time period for each jurisdiction. And then the ones and zeros starting in column D represent the answers to our coding questions from the previous slide. We also publish a code book with each data set that's used to identify the variables on this data sheet. So the code book includes all of the coding questions, the question type, the variable name, the variable value, and the variable labels. So that was a very brief overview of the policy surveillance method of creating legal data. I want to move on to where you can find high quality legal data if you're looking for some that already exist. But if you're ever interested in creating your own legal data, please reach out to us and we can point you to some great resources to guide you. Okay, thanks. So the first resource for finding legal data that I want to highlight is Law Atlas. So lawatlas.org is our legal data website at the center that houses 150 legal data sets that span more than 20 areas of public health. And for each data set that you find on Law Atlas, you'll see publicly available legal data. So the Excel files that I showed earlier. But on the homepage for each data set, you see first a brief description of the data set, as you do here. And then you can see on the right, there's a button that you can click to download the data. So if we click that, and then you'll have access to that Excel data sheet that has the legal data on there. There are also maps for each data set on Law Atlas that can be queried by the variables that were coded. So if you select a variable under one of the questions on the right, the states that have that variable will be highlighted in the map on the left. And you can choose different colors for different variables. So this is a screenshot of our state preemption data set. And you can see the first question there is, in which domain, if any, does the state preempt local government? So you can see the states with that purple or dark blue highlighting preempt ban the box laws. The states that have the light blue highlighting preempt firearm policies, etc. You can also view, for all of the data sets on Law Atlas, you can view the legal citation as well as the actual text of the law that was used to code each variable. And you can also find lots of other resources related to creating legal data on Law Atlas. So we have self-guided training modules on the policy surveillance process. We have information on our monthly webinars, on our upcoming Policy Surveillance Institute, as well as a bunch of resources on legal epidemiology methods and ways to contact us to request technical assistance. Another great source of legal data is pdaps.org. So this is the Prescription Drug Abuse Policy System. This is a site that we also operate at the center, and it houses legal data related to prescription drug abuse, substance use disorder, and harm reduction. And just as on Law Atlas, the legal data that's available on PDAPS is publicly available with a codebook, research protocol, and maps. And then the last resource I want to share here is the Alcohol Policy Information System, or APIS. So this is not one of our center's websites, but it's a great resource for quality legal data on laws related to alcohol and recreational cannabis use in the United States. So you can see some of the topics here on the homepage: alcohol beverages pricing, taxes, and there are many others. So if this is an area of interest for you in your research, this would be a good place to look for any legal data that might be useful for you. So I will now turn it over to Lauren for the next piece.
Hi, I'm Lauren Lang, and I'm a legal program manager at the center. So when you are looking at or conducting a study using legal data, all of your statistical operations could be spot on, but if the legal data that you're relying on is not of good quality, the rest of the study cannot be considered credible. So let's say you're reading a study that uses legal data, or you want to create your own study using legal data that has already been created. How do you know if that legal data is of good quality? That's what we're going to talk about now. So legal data for use in research requires a systematic process. Just like any scientific method, the key pillars to look for in identifying whether legal data can be relied upon are transparency, replicability, and quality control mechanisms. So, applying these concepts to legal data specifically, we have three questions to consider in determining whether legal data is of good quality. When you're reviewing a study that's analyzing the effects of laws and policies, you can ask these questions to help you determine the reliability of the legal data on which the study is based. To walk through these questions, we're going to go back to that example study that Katie talked about earlier in this program, which looked at state earned income tax credit and food security. The methods this study cites, the methods of this study cite to a paper specifically about the legal data used, and we can see that in the methods section. It cites to another paper, and that's what we're going to be talking about here. So we would go to that paper to gather more information about the transparency, quality control mechanisms, and the replicability of that legal data used in the study. The first question that we ask is there a description of the process used to compile the legal data? Or in other words, has the author been transparent about where they obtained or how they created the legal data? For legal data to be transparent, there must be a description of the methods used for creating the legal data. So let's look directly at the methods section of this anti-poverty policies and health article, and see what this type of description may look like and include. A description of the process used to compile the legal data should include a description of the types of laws included and excluded in the legal data. So here we see that the legal data for this study includes all laws outlining eligibility and benefits information on state earned income tax credits aimed at providing tax relief or refunds to low or moderate income working taxpayers. And we see that it excludes laws providing credits on other income supports to low to moderate income workers for assistance with food, housing, or childcare. Another thing you'll look for are the nuts and bolts of how they actually collected these laws that were included. So here you see that the researchers reviewed text of federal and state laws from Westlaw and Lexis and Westlaw, which are two legal databases. And you can see that the researchers used very specific search terms that are listed specifically in the method section. With this amount of detail, the process is transparent, and any researchers could go back and replicate this work. Lastly, to answer this first question about the process used to compile the legal data, you'll want to look for a description of the quality control mechanisms used to ensure the process produced reliable results. So here you can see that the quality control mechanisms included redundant coding, which means two researchers independently coded the legal variables and divergences were evaluated and resolved. And you can also see that the secondary sources were used to verify or validate the legal data once it was produced. The next question you'll want to assess in determining whether legal data is of good quality is whether the study used the best evidence of what's in the law. The best evidence of the law in effect at any given time is the law itself. You can see from the methods section of the same study that the researchers reviewed the text of the law, specifically statutes and regulations. Legal data created through press releases, interviews with government officials, or other secondary sources do not use the best evidence for what the law actually is. Then the last question to ask is whether the legal data properly measures exposure to the law. For this question, we're really thinking about to whom does the law apply? Who was exposed to the law? This will come up through both the jurisdiction, so the people in which location were exposed to the law, and the time frame, so the people at what time were exposed to this law. Again, in the anti-poverty policy and health article methods section, you can see that the exposure is within a specific jurisdiction. Here, people in each state. And you can see the time frame. So this is discussing people exposed to changes in the law between 1980 and 2020. And this is how the exposure may be clear in the data itself. You'll notice here that there's a separate row or record for each year and for each jurisdiction. So here we're seeing Alabama, but there would be rows for each state in each year to create an accurate depiction of the exposures. The exposure does not stop, though, at whether a certain type of law exists or not. As Katie mentioned, we're looking at specific features of laws often, not just whether a type of law exists or doesn't exist. So quality legal data will also track exposure to different features or characteristics of the law. So, for example, the map you see on the screen here asks whether state law allows for the operation of syringe services programs as of June 1st, 2024. You can see that 42 states are marked yes with this red indicator. That would mean that people in 42 states are exposed to this type of law. But a more nuanced look at exposure is how the state allows for the distribution of syringes from SSPs. Here you can see that the variety of ways the law allows for SSPs to operate, which could add important insight into any study that you may conduct into this legal data. So that's the three overarching questions to consider in determining whether legal data is of good quality. Here's Katie and my contact information. We're happy to answer more questions now, but also if you have any more in-depth questions or specific to your work, we're happy to connect outside of this as well.
Thanks, Lauren and Katie. Yeah, we don't have any questions in the Q&A. So if anyone has any questions they would like to ask, feel free to put them in the Q&A or the chat. Anyway, we have a question that's asking, are you aware of any international sources similar to Law Atlas?
There definitely is some international legal data out there. I'm looking quickly to see if I can find a good example. Thanks, Bethany. Yeah, the O'Neill Center. Let me see if I can find the link. Um, but that is definitely a growing area.
The person followed up, do you mean the O'Neill Center at Georgetown?
I believe so.
Yeah, yes, that is
Yeah.
at Georgetown.
Yeah, look for that.
I'm just looking for the link.
I think I got it here. I'll put it in the chat.
Oh, great. Thanks, Will.
If anyone else has any other resources for international law, Bethany put in HIV Policy Lab.
Thanks,
Well,
Bethany.
feel free to share them. We have a bunch of other questions. The next one is, how do you account for variation between jurisdictions in how and whether legal authority is implemented? This goes to evaluating the exposure to law.
So that's a challenge. That is definitely a limitation and a challenge of these studies is measuring what, we talked about creating legal data which measures what the law says, but it does not measure whether or not the law is implemented or to what extent it's enforced. So that is definitely a challenge and something that has to be analyzed or recognized as part of a legal epidemiology study, and would, if there is a way to include that as a separate analysis, looking at implementation and enforcement, that's great, but often that is difficult to do. So I think being one thing that's key is being transparent about that in methods and in protocols, is that, if you're not looking at implementation, just being clear about that is a limitation. I don't know, Lauren, if you had any other thoughts on that.
Yeah, no, I think that you're spot on. I do think that it's important that we recognize that both of those types of studies are important, right? So legal epidemiology about the law on the books and its impacts is an important step, and implementation studies are absolutely a necessary step in recognizing the fuller, the more holistic view of what's happening.
Great, thank you. The next question is, can you talk about the challenges of correctly capturing policies implemented in the past, i.e. ones that might be decades ago? I assume there might be less, information online, certainly, for that kind of thing.
Yeah, absolutely. That is quite the challenge. And we spend many hours every week looking for a lot. So I think that we use as many tools as we can, right? So we utilize Westlaw and Lexis's historic uh, research tools. Databases like Hein Online have a lot of legislative materials going back far, and then state legislative websites. And we piece together as much as we can. And yes, if you get back past 2010, it gets harder, and then harder and harder as you go back further and further. And I will give a warm-hearted shout out to Temple's law librarians, who are fantastic all the time when we hit we hit barriers. So really just working as a team, collaborating with people. But there's a lot of tools out there. It is a slog sometimes though.
Do you ever do any in-person research to make up for gaps?
So I have not done that, but there are some stories about, especially in the realm of local policy or local laws, municipal laws. Ross Silverman, I think, has like the infamous story of a project where they traveled to a lot of municipal government buildings and had to take pictures because you're not allowed to photocopy, and just lots of crazy stories about collecting laws from smaller municipalities.
There's Ross and his colleagues wrote an article on some of the challenges of talking about what Laura was just talking about, some of the challenges, especially with collecting local policies. So I will put that in the chat if anyone's interested. Local local policies definitely can be more challenging than state policies, just because they seem to not be as readily publicly available. Share that.
Thanks. Yeah, if anyone has any other questions, feel free to put them in the Q&A or the chat. I had an additional question. I was wondering, do you ever get contacted by legislative either aides or politicians or people who are, interested in changing laws or want to do research about potential law changes for your data sets or for your tools or anything like that?
That's definitely something we're working on, is disseminating. We always disseminate all of the work that we produce, but trying to really make sure that it's available and accessible to not just researchers who want to study the effects of the law, but also to policymakers and folks who are trying to adopt policies that have that may be able to improve health. So um, it is. It is definitely something that we're sort of always thinking through um, how best to make those connections.
Yeah, I think we have two projects that highlight that really well. One is our Pennsylvania Opioid Settlement Project, which if you Google that, you can read more about it because Temple put out featured it recently. The other one that comes to mind is our City Health Project, so cityhealth.org. And I don't know if someone wants to throw that website in the chat too, is a really cool partnership that we do the legal data for. And then it's in partnership with the De Beaumont Foundation and um, Kaiser Permanente, Kaiser Family Foundation, one of those. Um, and so we do the legal data that backs this website that like the data on the website that you see, but then our partners are in communication with local leaders of the 75 largest cities in the country, and they actually have local leaders reach out to them about they get medals when they get ranked high in this, so they like to get the medals, but they do reach out to ask, like, how's the best way to write this policy? And they work with our partners there. And so it's sort of like a joint venture in addressing some local policies that impact health.
Thank you. Yeah, and if anyone has any additional questions, feel free to put them in the Q&A or the chat. I was also curious if there are students who are interested in your work, um, whether they're in the law schools or not, like do you have like internships, or do you have opportunities for students who are curious to learn more or work with the tools that you've all developed?
Yes. I'm trying to get back to, sorry. Um, So we have law school internships. We have historically had some undergrad and master's level interns as well. And so we're still working through the capacity for this year for undergrad and master's level interns. But we also host some practicum students at the master's level as well. So I am actually the contact person for our internship program. So if you have any interest, if you're a student on here, you have interest in our work, please feel free to reach out to me by email, and I'm happy to set up a time to chat or put you on our interest list. So when opportunities come out, that you can get alerted.
Great, thank you. Um, I don't see any other questions. Is there anything else you'd like to share with the group and the recording, or before we finish up?
Just to thank you for for the opportunity. It's always great to collaborate, and yeah, happy to be able to share a little bit about the importance of legal data.
No, thank you for coming and for speaking about your work and your all the hopefully fruits of that work. Yeah, thanks everyone for attending.